Hello everyone, once again, welcome to Health Tech with TDS. I'm Rafa Riyaz Akthar and today we are here at Kim's Oman to interview Dr. Ashok Thomas. Hello sir,
Hi,
thank you for your time.
thank you for inviting me to this platform.
Could you please say something about yourself?
I'm Dr. Ashok Thomas. I'm a specialist dermatologist working with Kim's Oman Hospital since the past 8 years now. And I take care of the dermatological and cosmetological needs. That's pretty much about me. And before joining Kim's, I was teaching in a medical college in Kerala.
So you used to teach dermatology?
Yes, I was an assistant professor in a medical college, assistant
Where
professor
in
in
Kerala?
dermatology in Chalaka. There is a place called Chalaka
Chalaka.
in Cochin.
In
Yeah,
Kochi.
in Cochin.
Okay,
Yeah,
okay, that's really nice.
thank you.
So I have a few questions to ask you.
Mm-hmm.
Yeah, so my first question will be very relevant to the current situation.
Okay.
How does face mask affect our skin?
Yeah, very apt question for the present pandemic situation. As we all know, since 2019 end and 2020 beginning onwards, everyone is on face mask as a protective layer to protect us from the pandemic. But then it had its own problems, which came into surface by, say, around April, May, once everyone started using the face mask continuously. And there was a term itself for that skin condition. It's called mask acne or maskne.
Mask.
People, when they continuously wear face mask, it prevents the heat from going out of the body through the pores, which increases the sebaceous gland function. There is creating new pimples on the face, pimples or acne in the face. So whatever we used to see as teenage acne became common for any age group now. So that was one very bad thing which happened with the mask, even though it protects our lives. But then, from a dermatological point of view, aesthetically, it created some issues.
Yes.
That's okay. Yeah.
So what can you say about skin pores? Why are pores caused?
Yeah. We will see. We normally see some people with wide pores and some without any pores, like smooth skin. Pores are actually the external openings of the oil glands. So when a person has a little more of an oily type skin, their pores will be more evident. Whereas a person with a little dry skin or a combination skin will not have that much of pores. So an oily skin person will always have the problem of active pores because the oil needs to come out. That's the reason for the pores in different skin types.
So is there any prevention for that?
There are. We do treat with certain oral medications which dries the oil gland permanently. Once oil gland is dried, the pores function is irrelevant. So naturally, the body tightens. That's one thing. Then there are topical mild acid-based creams which we give to reduce the oiliness of the face. Once the oiliness is gone, once the face is dry, the skin is dry, naturally the pores tightens up.
Okay.
And for people with large acne problems where the scarring is big and the pores are wider, there are many treatment modalities like hydrofacial, which can work for small pores. Then there are derma pen or derma roller treatments for medium sized pores. And if it's larger pores or a person wants immediate result, we do fractional carbon dioxide laser treatment.
So my next question is from which age skincare becomes mandatory?
Yeah. Contrary to the previous belief that skincare is required only when you start seeing wrinkles on your face, nowadays we as dermatologists we suggest the earlier you start your skincare, the better the skin will be at an olden age.
Okay.
So from 20 onwards, it's better to start with a proper routine. And if you have oily skin during your teens, then it's always advisable to have an oil-free face wash and basic normal routines. And nowadays, what we see, the trend is minimalistic makeup. Not much. Don't use a lot of makeup products to close the pores because your skin needs to breathe. So let it breathe. Once the skin breathes, what happens is the oxygenation of the body. It helps to rejuvenate the body, and it helps in the skin type. And if you can use a hyaluronic acid based gel or a night cream which supples the face and it doesn't have much stronger chemicals or anything, and hyaluronic acid is a naturally occurring ingredient in our body, so it helps to increase the collagen and the suppleness of the skin.
Okay, that's an information for me too.
Thank you.
So, doctor, after a certain age, why do we see discoloration in our face?
Yeah, that's a very good question. What happens is after certain age, maximum we see the discoloration of the cheeks in ladies, which is known as melasma. It's otherwise known as cloasma or a mask of pregnancy. When a lady becomes a mother due to the hormone changes, an increased melanin deposit occurs on the cheeks. This, on reacting with the UV rays in the sunlight or from the systems or the CFL lights, slowly starts getting pigmented. That's one thing. Second thing, ladies sometimes they will say that during delivery time we didn't had any pigmentation, no issues were there. But then towards 45 or above, they will start noticing the pigmentation. Again, it is hormonal. When they are reaching their premenopausal stage, it can happen. And 30 percentage of men also develop same melasma. That's because there is a condition called andropause. Same like menopause in females, there is something called andropause in men, which starts from 40 onwards based on their genetic makeup. And once andropause happens, the testosterone dip happens. That causes a little increased melanin production on the cheeks. And again, same thing, melasma for men and women. These are the reasons.
That is, you are giving me a very good information. Thank you so much once again. So, I have a lot of questions. So, my next question will be, what are the causes of dandruff and how can we control?
See, when you talk about dandruff, what we need to realize is it may not be dandruff at all. I get a lot of young kids in the early teens brought by their parents saying that too much of dandruff is there. Actually, it's called seborrheic dermatitis. It's a condition connected with the pubertal hormone changes where the oil glands on the scalp gets more active and it produces more oil, which comes and dries. It forms larger flakes or scaling, contrary to the popular belief of dandruff. Dandruff is like fine powder, and dandruff spreads from person to person, whereas seborrheic dermatitis will not spread. But at the same time, once seborrheic dermatitis occurs, on that a type of fungus can grow which mimics dandruff. And teenage time, by 13, 14, once the oil glands gets overactive, this seborrhea starts. And as I told you before, it can last up to 40s till the hormone dip happens. And the triggering factors are actually spicy food or oily food. The more spicy food you take, the oil glands gets more active. Oily food you take, oil goes in, oil comes out.
So, that's for Indians basically.
Indians basically. And even in the European community, what we have seen is they have more of a scaly seborrhea type of condition, not the active, the fungal induced dandruff. So even that's based on their lifestyle, the habits, and the richness in the food. More of oily food or fatty food they take, more of your oil glands gets active. These are the reasons.
Thank you so much.
Okay.
So, is sunblock important for our skin?
Yeah, that's actually a debatable question. Sunblock is needed to protect us from the harmful UV rays, especially when you are in a country like Oman or in anywhere in the GCC where the sun is a little harsh on your skin. It's always advisable. But then, if you have an oily skin, then I prefer not to use a sunscreen on your skin because it again blocks the pores. And one very important thing is any sunblock you apply, the effect is only for 3 hours. So after that, you have to reapply. So don't think that morning you applied sunblock and the whole day you are protected from the harmful UV rays. So that's one thing. And there are people who have something called photodermatitis or sunlight allergy. Such people, yes, definitely sunblock is needed. They have to use it all the time to protect their skin. And there are cases where you would have seen vitiligo. the white skin condition. They lack melanin. Such people, if they get exposed to sunlight a lot, their chances of developing further skin cancers and things like that are more. So they definitely need sunblock. So it's a choice. It's a choice.
It's very informative. So, what is your message to our desert story viewers?
The basic skincare regimen, which we as dermatologists suggest for everyone, is a good cleanser, a toner, an astringent based product, and a hyaluronic acid based moisturizer at the night. This actually cleans the pores, reduces the oil and the sebum, opens the pores, unclogs, lets the skin breathe, and a hyaluronic acid will make it more supple and it helps in anti-aging process. And a very good diet accompanied with this type of regimen will keep your skin away from wrinkles and sun damage for quite some time.
Thank you so much, Doctor. It was indeed a very informative session with you today.
My pleasure. Thank you, Rafa, and thank you, Desert Stories, for giving me this platform to give few skin tips for our dear friends. Thank you.
Hope this session was informative for you all. For more such videos, don't forget to like, share, and subscribe. Until we meet next time, it's me, Rafa Riyaz Akthar, signing off.